Medicine in 3 minutes, back here with another video, and today we're going to be talking about the carpal tunnel syndrome. Alright, here's a brief overview of what we'll be looking at. So we're going to be looking at the carpal tunnel and its anatomy. We're going to be looking at the carpal tunnel and how it is affected by the median nerve. We're going to be looking at some of the symptoms, and essentially there are four main symptoms that we can list. They're going to be pain, numbness, tingling, and weakness. It's going to be numbness or burning sensation, and it's going to be in the thumb, the index finger, the middle finger, and the radial and half of the ring finger, so only the first half. And there's also going to be tingling, which constitutes, again with the numbness, the hallmark symptom of the median nerve entrapment, so this is very important, number 3. And the fourth is going to be a weakness and atrophy of the thumb, which may occur if the condition is not treated, so you definitely want to get that treated. So there are two maneuvers that we can highlight the compression, or in other words find out if a person is dealing with carpal tunnel syndrome. So basically the back of the hands are pressed together, which basically essentially is going to compress the nerve, and this may cause carpal tunnel syndrome. So you're going to repeatedly tap the wrist, and if there is a tingling and it consistently worsens with the tapping, then you are most likely dealing with carpal tunnel syndrome. Now, there are also various different things that can cause carpal tunnel syndrome. Now, the first is going to be obesity, hypothyroidism, arthritis, more specifically rheumatoid arthritis, repetitive hand or wrist motion. So if you're a gamer, this could be dangerous. Diabetes, wrist injuries, fluid buildup or nerve damage, and the last one is pregnancy. So there's actually a few ways you could treat this. Now, there's several therapies that are proposed to treat the syndrome, but first we have to identify a possible cause that we can evict. So the wrist is going to be maintained in a neutral position by wearing a brace or a splint, and there are going to be some drugs that can help relieve the pain. If that doesn't work, then you want to go into cortical injections, and if the pain still persists even through that, then you might want to go into surgery. So just a recap of the treatment: you want to start by putting the wrist of the hand in a neutral position by wearing a brace or splint. If you need to take it a step further, if it is moderate to severe, you're going to want surgical release, which is basically going to allow a release of the tendon, which is going to really help it relax.